Major support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Colonial Life, providing benefits to employees to help them protect their family, their finances, and their futures. High Point University, the premier life skills university, focused on preparing students for the world as it is going to be. And Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
Our everyday life has become interesting. The coronavirus, and as weary as we may be of the headlines, will indeed have far-reaching effects, and the public health risk is only one aspect. But then again, it may not be as bad as we think either. Someone once said that things are never as good or never as bad as we expect, that we live somewhere in the middle. Welcome again to the most widely watched source of Carolina business, policy, and public affairs, seen every week across the Carolinas for almost 30 years now. On this program, the Chief of Healthcare at healthcare provider UNC Health joins us, Dr. Wesley Burks. But before that, we'll wade into this week's issues across the region with our expert panel in just a moment. Stay with us.
Gratefully acknowledging support by Martin Marietta, a leading provider of natural resource-based building materials, providing the foundation upon which our communities improve and grow. Blue Cross Blue Shield of South Carolina, an independent licensee of the Blue Cross and Blue Shield Association. Visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Barings, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, Sepi Saidi of Sepi Engineering and Construction, David Lockwood of Colliers International, and special guest, Dr. A. Wesley Burks, CEO of UNC Health and Dean of the UNC School of Medicine.
Welcome again to our program, David. Good to have you back. Sepi, nice to see you again.
Thank you very much.
Thank you. David, so you know a little bit about construction and development and land use and transportation, et cetera, et cetera. Is COVID-19, which is what we call the coronavirus, will this slow down commercial development?
No. And the short answer is no, it will not, because there's such a head of steam out there for development right now. And development is taking place in the right fashion. The underlying principles are really good. So I think what we're talking about is a short-term blip, but the pipeline is so full, I don't think anything will slow down.
But not to keep pressing you on this, but when you model out, okay, we've got a project in Columbia or Charleston or Greenville. When you're modeling that out and you've got commitments from an anchor or a major investor, and they start to get cold feet because they're not sure what COVID's going to do to the underlying economy, doesn't that concern you?
I actually think they're going to be putting more money into real estate. There's a little bit of fear in the stock market right now.
Sure.
Returns are down, so more money is flowing into the real estate market because of the low interest rate and the availability of funds.
Same question, Sepi.
You know, I agree with David, and I don't. I think it's two-part. I agree that the fundamentals of economy is very, very strong. Real estate strong. Low interest rate is going to get everybody's attention to go invest in real estate. The part that I may not agree as much is if this fear lingers on, if it becomes a long-term, we're talking about a year. Yeah. If this continues on, which is really not that possible, I don't feel that's going to be the case, but that would be the worst case scenario. If it goes on for longer than a few months, then I think that could potentially have an impact.
The Carolinas both have very important and big needs for transportation, funding and plans and deployment and beyond curbs and highways, but bridges, development, et cetera, et cetera. Sepi, do you think that transportation funding and plans that have already been made, do you think they're at risk?
Do I think they are
at risk?
At risk with the coronavirus?
Yeah, with the effect of whatever people
I don't think so. I think that we have a different source of funding for our transportation plan. And I really don't think the funding would be impacted. I think the growth and the strong economy, we have a real wind behind our sails. So I'm very optimistic, and I really don't think it's at risk. But again, if it becomes a long-term impact, then there would be something we need to be concerned about.
But on a positive note, and with growth and a strong economy, I think there are major manufacturers in the United States, in this world, that are going to really start looking at their supply chain. And do we put all our eggs in one basket with manufacturing in China? Cheap labor, cheap materials are no good if the plant is shut down. And so I think there are major manufacturers that are going to start looking at the future. And do we put plants in Mexico? Do we have them? Do we come back to the United States with manufacturing plants? Do we have them in China and spread them out in case there's this issue, health issue in the future?
Well, David, to that point, so one of the largest trading partners for South Carolina and North Carolina is China. So have we put too many eggs in one basket, and especially South Carolina with the high concentration in aerospace, which is airlines, and automobiles?
I think in those cases, possibly. Aerospace is one of those that could be impacted with a prolonged impact to the economy. If people stop traveling, there's not the need for as many airlines and new planes being built. So I think long term, those can be impacted.
Sepi, you're on the board of the Federal Reserve, the Richmond Federal Reserve, which of course includes the Carolinas, this district. Our jobs look good.
Yes.
We've got low unemployment. Does this worry change all of that?
I think that a coronavirus, this situation is so rare, it's so random, it was so unexpected. It really is difficult to predict the future or have a real clear perspective on what's going to happen. It is not as dangerous as everybody thinks about, so that's a really important message that I see is getting out there on internet everywhere. Everybody's talking about it. This is not any more dangerous than a flu. But the key, I think, is that we need to make sure that we get enough awareness out there. Talk about this, that just do the right thing, wash your hands, don't panic.
Right.
We're going to get this under control. They are developing a vaccine for it. So I don't really think it's going to have a long-term effect. And we really need to be proactive about getting the right message out there and not panic. People do not need to panic. We do not need to overreact. Just being prepared and using common sense is going to get this under control.
And David, last question before we bring our guest on. We know that emotion fear is a powerful emotion. Can the fear of this be enough of a shock to consumer confidence to cause a recession?
I don't think there is the fear of a recession, and I think what we need to talk about in a few minutes is what's the longevity of this in the United States. There's an immediate impact, short-term impact, fewer people going to restaurants, fewer people going to sporting events, large venues, conferences, and things like that. But how long will that last? And is it more short-term through a flu season type of period?
So in the Carolinas, the tourism is important. Obviously,
tourism
hospitality
is very, very important
could be at high
and
risk.
at risk, yes.
Yeah. Would you agree with that?
I would.
Yeah.
I would.
Okay.
Yes.
Let's bring our guest on, ask him some of these questions. He's probably going to have an opinion, I would guess. Next week on this program, he's been on our program before. He's the Chief Law Enforcement Officer. Well, it would be for any state, but specifically in North Carolina. Josh Stein is the Attorney General, and he joins us again. Also, speaking of Attorney Generals, South Carolina's Attorney General Alan Wilson also coming back to this dialogue as well. From the opioid crisis to retirees' health care cost benefits to COVID-19 to rural health, there are some secularly large challenges for health care, and more specifically, health care providers. Hospitals. Joining us now is North Carolina's largest academic health system CEO, Dr. Wesley Burks. Dr. Burks, welcome to the program.
Thank you for being here today.
Did you recoil at all when I stuck my hand out to shake it? I didn't see it, but was it a worry for you?
I think that today, to think about the transmission of COVID-19, the coronavirus that we're talking about, then I'll do differently than I would have 2 weeks ago, yes.
But you are, and not to press you on this, Dr. Burks, but you are a researcher. You're a pediatric doc. You've been around research for a while, not just in administration. So what goes through your head with COVID-19? Is this a lot of hyperbole, not much risk? Are we valuing it the right way? Help us understand this.
COVID-19 is a serious and important both public health and personal issue that we all have to talk about as we think about our society and our health. To try to put it in perspective, what I hope people hear and understand is that we have a healthy respect for it. That if we compare to the influenza vaccine and what it might do for society, in most countries that don't have an influenza vaccine, COVID-19 will be somewhat worse than influenza going through that country. It has a life of not many people infected, a lot of people infected, and then it begins to go away. Is that a month or 6 weeks or longer? That's difficult to tell. But certainly as it comes through, it can cause significant health problems in the elderly, those that have chronic disease. More people will die from it in that outbreak than would from influenza.
Will you expect that life cycle for this disease to be fairly similar, though? The expansion and the contraction and eventually the control of it?
From what we've seen in China and other places as it's come through, you'd expect it to be about the same, but there's a little bit of unknown about that.
Mm-hmm. So what do you think justifies the fear? This seems like it's been a larger fear than past.
It's an unusual coronavirus. Coronavirus in general are the viruses that cause common childhood illnesses, other colds that people catch, but it's a novel one, and so it's a little bit different. The infectious rate is a little bit more than you would expect with influenza. The seriousness after you get the infection is higher than influenza. Mm-hmm. It's not like hemorrhagic fevers or SARS, but it's still significant. As an example, in Italy, 10 days ago they had 20 cases, and now it's almost 4,000. They had nobody that had died 10 days ago, and now they have hundreds. Mm-hmm. So that the rapidity of how quickly it is spread, and then the significance of people becoming really ill, even though it's in a select population, is pretty significant.
So, and I promise I'm going to give you one more. So does this tap into some contemporary feel we have about zombies? And I know that sounds funny, but there's some end of the world zombie thing going on here. And I'm saying that to you with a straight face, and it sounds funny coming out of my mouth, but there seems like this fear has been way overstated.
There are, and what's happened in the last 3 decades, every few years there's an unexpected, unanticipated illness that's spread throughout parts of the world, regions of the world, or worldwide. Go back to some of the West Africa and hemorrhagic fever viruses, the SARS virus itself. It's not unexpected from a medical standpoint that you would have an unusual contagion and it would spread. It has a shelf life that will happen. One of the unknowns for COVID is that what happens when it comes through now, and then will it come back like influenza would in 9 to 12 months? And what does it look like at that point?
Thanks for unpacking that a little bit more than you probably thought you'd have to, but thank you.
I think from a public health, personal standpoint, that there are things that individuals can do that will be reassuring to them, still have that healthy respect, but will protect them individually, washing hands, hand sanitizer, if you're symptomatic, not going out in public, so that you don't spread your viral illness to others. Those are helpful things, both personally and from a public health standpoint.
David?
So the health of our population is the most important factor here, but we have this collision of health issue and the economy right now that's taking place real time with where we are right now. So be more specific. How long is this period that you anticipate we will be in where we have these issues of an economy being slightly damaged because of a healthcare issue?
For the U.S., if we base on what happened in China, you would expect 30 to 45 days of the disease coming through, running through the population, and then beginning to go away. It's a little difficult to tell that we have all the correct information from the Far East, but if what we know, we can anticipate that's the time frame that it would come through. What's unknown for us in the Carolinas is the number of people that will be infected, and then out of that number are the people that have really serious illness. But we're not looking at something that would be continual for 4 or 5 months. based on what's happened in other countries.
Sorry.
I have heard about this vaccine that is being developed. Can you kind of shed some light on where is it being developed? Is UNC working on a vaccine? How much longer before it could be, from what you know? Any ideas about the vaccine?
The Carolinas are fortunate in that they have a group of physicians and researchers at the UNC Gillian School of Public Health, the UNC School of Medicine, and others that have been working on this group, family of viruses, for decades.
I see.
And so personally, as I talk to them, then I have comfort in that we have really international experts in this type of illness, this disease, that can give us really good up-to-date information. So that's a comforting thing for all of us. There's researchers in Chapel Hill that are working on a vaccine now. They're also working on different types of drugs that will treat the disease. Right now we have supportive care, oxygen, IV fluids, other good health care to support someone, but no specific treatment. So I'm comfortable that with them and others internationally that within a year a vaccine can be developed, but it will take that long.
Oh, that's good news.
How has this affected the healthcare worker, first responders, those that have to be on the front line of this, the stress of the healthcare worker, the thought that they have when they're down there in the trenches, so to speak?
For us at UNC Healthcare, we talk a lot about our mission, which is to promote the health and the well-being of the people in North Carolina. This is what we're there to do. We're here to provide health care, to help people stay healthy, become healthy. But also important for us is the health care of the people that we work with, our fellow coworkers. So we're doing everything that we can to take care of people appropriately, to help them understand the public health, personal health measures that will help them not get infected, and at the same time talk with our coworkers about how they can be protected as they take care of these patients.
We've got a very diverse economy in the Carolinas with urban and rural areas, and I know rural health care is important to you. When we talk about the coronavirus, is it more of an issue in the urban areas, or does it spread to the rural areas as well? And how does the rural populace really get adequate health care for this type of virus?
Mm-hmm. So the difference in the urban or rural will be contact. So the more people you're around, the more likely you would come in contact with someone who is ill. So that difference will be there. But once you have the disease, then it's not going to be different where you live. It's important for us that the UNC Healthcare, our system that we have at UNC Health, that we provide good health care to everybody in North Carolina that we have the opportunity to. The highest quality health care is close to home. So the rural hospitals that we work with that are part of our system, from Jacksonville all the way out to Hendersonville, whether you live in Eden or whether you live in Johnston County or Raleigh, that you get the same health care. And that's what we're doing every day right now.
I want to go back to this rural health care, and I believe that North Carolina is a prosperous state and doing amazing things, but I feel that we need to do more for Eastern North Carolina specifically. And healthcare in Eastern North Carolina, can you expand a little bit more about, or do you have specific initiatives in Eastern North Carolina? And how does telehealth, because they do not have broadband, and that's a really important issue that we really need to focus on, broadening their access to broadband. And just initiatives there, how does that telehealth could help in the future? Where do you see we could do more for the Eastern North Carolina?
Okay. North Carolina has 3.4 million people that live in rural areas, second only to Texas in the country. So it's an important issue as a state of 10 million people that almost 35% of us live in rural areas, heavily concentrated in the eastern part of the state, kind of in the western part of the state. Similar but different issues. For part of the reason we've put together our healthcare system is to be able to serve the people that live in rural areas. So our help in hospitals like Rockingham and Johnston County, other counties in the east, to provide them services that they couldn't provide otherwise without being part of a system, to be able to find the right supplies, catheters, things like that. We also are partnering with them to make sure that they have enough healthcare providers, the physicians, the nurses, physician assistants, to be able to take care of people.
Yes.
We're also doing things with, as you suggest, telehealth. We have an app that you can use on your phone that you can have 24/7 emergency access, basically a FaceTime. So I can call anytime I want to get health care. We're also doing telepsychiatry so that we could provide backup to their primary care physicians and others in those communities to help them with their behavioral health needs. So a lot of things that our system can do increasingly to support the people that live in rural areas of North Carolina. It really doesn't feel good for us that if you live in Eden or Raleigh, which is not that far apart, that your health care right now is really different, and it shouldn't be that way.
You're right.
Let's go to the business of running a provider, running a hospital in the age of unsure, very fluid healthcare policy in the U.S. A state in North Carolina, as well as South Carolina, has not accepted Medicaid dollars yet. In North Carolina, that hasn't even accepted a budget yet internally in the General Assembly. And I wrote this down because I thought this was very compelling, that the branding of UNC Health is a commitment to transformative change. Did I say that right? So, Dr. Burks, how do you go through all of these variables? Not just model out and plan a budget, but how do you get to a lot of discussion around the wholesale cost of delivering a service or medicine to anyone? How do you understand what that cost is? Do you expect more hospitals are going to figure out what the raw material cost to deliver, and how does that affect the arc of running a hospital?
So the business of healthcare has become way, way, way more complicated in the last decade. There are a number of external factors that are affecting how we provide healthcare for people. The change for how we do the financing of it from fee-for-service to value-based care.
Right.
I like to think about healthy-based care.
That was part of the General Assembly's plan, that not
Right.
quite there yet.
And that's the national event that's happened. It's happening everywhere. About 20% of what we do right now is in the value-based care. It increasingly will be that way. The second external huge factor that's affected us is that lots of providers, Amazon, Blue Cross, others are doing healthcare. They used to be bystanders to look at it. The third part is, I call the Netflix phenomenon, that particularly the younger generations want healthcare when they need it. And at that time, not to take off at 1:30 to go to a 3-hour appointment.
So on demand.
And the consolidation nationally that's really not affected by the political environment, all that's going on. That's why we've transformed ourselves to UNC Health, because of those external factors. The biggest part that we talk about every day is how do we take care of a patient, provide them high quality health care as close to home as we can, and increasingly try to do it at a cost that is affordable for them. Many of the families that we take care of now work a week of that month to provide their health care, and that's too much. Health care costs too much for us as a nation. It costs too much for us personally. We're doing a lot of things specifically in our healthcare system. Part of the growth of the healthcare system is to provide care in the rural areas when they couldn't otherwise. We're opening outpatient clinics, day surgery centers, new facilities, urgent care centers to provide health care in areas not in the hospital that will be at a lower cost.
Can you get to what that cost will be? Does every hospital need to get to what that wholesale cost will be?
It's important long term and in the short term that we're transparent with what the costs are. What we're doing with our coworkers now is that if you have some event coming, that they can call up ahead of time and know what their copay will be, what their out-of-pocket expenses. What we hope to do with that is to expand that to our whole healthcare system. In the future, it's important that when I have a procedure that I know the cost, that I can get counseling ahead of time, that I can call to be able to do that. It's also in the future for contracts with Blue Cross and others that we can publish what those costs are all across our system.
Do you find that the payers want that as well?
Yes, they do.
So would you expect, and I know this is a big question, there's a lot putting in this bag here, would you expect some salient, solid, or more solid national health care policy to emerge in the near term?
I do think both from a state standpoint, the things that are being discussed politically and then nationally, that there will be increasing reasons, laws that come that we need to be much, much more transparent than we are right now. And it's a good thing. We need to do that. Yeah. That's the right thing to do.
Do your colleagues at other providers feel the same way? Are you all on the same page here?
We're getting there,
Yeah.
yes.
Okay. Dr. Burks, thank you for being on the program and for being very calm about COVID-19. It seems like and your predecessor as well, Bill Roper, who I know you know well, and his arc through the CDC and your conversations. I'd love to be a fly on the wall between the two of you, but thank you for bringing that to the set. And thanks for your leadership.
Thank you.
Nice to see you. Sepi, always nice to have you on the program.
Thank you for having me.
Okay, thank you. And David, good to have you here as well.
Thank you.
It's always
good to be
nice
here.
see you. I hope your predictions about commercial real estate hold up.
I'm hoping they do.
As well as the economy. I'm sure you do. Thank you for watching our program. We hope all your business is good and certainly your weekend. Until next week, I'm Chris William. Good night. Happy weekend.
Major funding for Carolina Business Review provided by High Point University, Martin Marietta, Colonial Life, the Duke Endowment, Barings, Grant Thornton, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. For more information, visit carolinabusinessreview.org.